My name is Nick, the EMF Guy Pinot. I'm the host of the 2024 EMF Hazard Summit. Welcome. In this presentation, Dr. Neil Nathan will teach his exact approach to fixing electrosensitivity. This conversation cannot be considered medical advice, of course, but will surely help you navigate these medical questions with your own health practitioner. You will learn about the two key systems in your body that together are responsible for these extreme levels of sensitivity that many people experience. Then you will learn how to start healing those systems, helping you get better over time. Dr. Neil Nathan, MD, has been practicing medicine for 50 years. He's also widely recognized as one of the foremost experts in treating mysterious cases of illness that other practitioners just aren't able to figure out. He specializes in mold toxicity, Lyme disease, multiple chemical sensitivities, and chronic environmental illnesses. Let's dive in. I'm here with Dr. Neil Nathan. Dr. Nathan, thanks so much for being part of this 2024 EMF Hazards.
Thank you for having me, Nick.
It was just very natural for me to re-invite you on this presentation because of your expertise around environmental medicine and the fact that you're one of the few doctors that I think has a deep understanding on how to treat electrosensitivity. But please, in a few words, give us, before we start the conversation, what is your background and what is your current practice or consultancy work like?
Well, I've been practicing medicine as an MD for over 50 years, and over the course of my career, I became interested in those patients who fell through the medical cracks, who had conditions that my colleagues didn't understand. And so I studied far and wide to try to understand what was making our patients sick. And those included patients with things like chronic fatigue and fibromyalgia, neurodegenerative illnesses, autism, things like that. And we realized over a period of time that there were actually causes for these things that we could treat. They weren't just labels that we gave to patients that, I'm sorry, you're really sick and I don't have anything for you. But actually, no, this is an actual treatable condition. And that's particularly true of electromagnetic sensitivity. So that's becoming an epidemic, unappreciated by the medical community. And so what I'm hoping to share with your audience today is what we've learned about that. And my take-home message is we can treat it.
Tremendous. That it will be a tremendous amount of hope for a lot of people listening to this, and also for health practitioners, as I was mentioning before we started this presentation, that many practitioners are maybe uneasy or unsure what to do with these patients in the first place. And if they let these patients navigate the more conventional side of things, in a lot of situations, they get told that it's all in the head or it's a psychological issue. But as far as electrosensitivity goes, you have 50 years of experience as an MD. How has this condition evolved in your years of practice?
Well, it went from being fairly rare to being way more common now. I would even put it in the epidemic category, that the shift from 4G to 5G wasn't just a shift of 1 from 4 to 5, but a shift of a massive amount of more and additional EMF stimulation came with 5G. And with that, we're seeing that trigger a whole lot of issues for people that they had not appreciated.
So is it that, how do you perceive electromagnetic stress? Is it a cause of electrosensitivity, one of the contributing factors? Which one do you think?
Both.
Both?
I think both. So let's try to put it in context.
Sure.
First, let's try to understand what makes a patient sensitive to anything. And the answer is there's a part of the brain called the limbic system that regulates, monitors, and controls sensitivity. It also controls emotion. So that any type of sensitivity, sensitivity to light, sound, touch, food, chemicals, and EMF, is all, at least in part, regulated and controlled by the limbic system. It's not psychological. This is neurological. It's literally a part of the brain that has become sensitized or overreactive. The limbic system's job is to protect us. And it tries to protect us by perceiving threats, by looking at all the stimuli we're being exposed to, both internal and external stimuli. And if we are being exposed to something that our limbic system thinks is not safe for us, it will let us know by giving us symptoms. Now, these symptoms may not be pleasant. They may be fatigue or cognitive impairment or headaches or neurological symptoms, but it's not trying to hurt us. Our limbic system is trying to tell us, hey, there's something out there that is not safe for you, and I'm just trying to warn you about it so you can get away from it. So that's the job of the limbic system. The So whenever someone has any type of sensitivity, and EMF sensitivity is right up there with all of the other sensitivities, you always have to look at the limbic system. Now, I'll make this a little more complicated. The limbic system is almost always working with its tag team partner, the vagal nerve system, which is a different part of the brain, which also is, as a job, monitoring the body for safety. So these two brain-based symptoms, again, I want to emphasize, not psychological, neurological. These two systems are out there scrutinizing the environment to go, is that safe? So when anything affects those systems, the vagal system, the limbic system, we become more sensitive and often, as a corollary, more emotional. So it's very common to see anxiety or depression or OCD flare up or fire up along with the sensitivity because it's controlled by the same part of the brain. That's the beginning of this discussion.
Well, it really speaks to me. I was slightly sensitive as an author on EMFs back in 2017, and the symptoms that I got from Wi-Fi exposure were sometimes unexplained anxiety, as if I'm anxious of, well, I think that's the definition of anxiety, isn't it? Being anxious about nothing, really. Everything was going well in my life. I had money, loving relationships, everything was going well. And all of a sudden, I had this feeling that there's something deeply wrong and urgent and threatening in my vicinity. And sometimes it also was a depressive symptom, and sometimes it was brain fog. But can you get into some examples of how sensitive someone can get? Because I think there's a lot of disbelief around, oh no, you cannot be that sensitive to one phone, for example. Do you have examples of extreme degrees of sensitivity, just to give listeners an idea of how sensitive someone can become to this agent of cell phone radiation, of electrosmog, so to speak?
Yeah, absolutely. One of the ways that I first began to realize that it was an epidemic was that at the time I was practicing in Northern California, and California had instituted smart meters, which is, so instead of people coming out to the house to looking at the amount of electricity you're using, they installed the smart meter so they can get an automatic feed. They didn't have to pay people coming out to the house, and these smart meters were installed in phones. We had the option of not doing that if we wanted to. But back in those days, a lot of people didn't appreciate what smart meters were going to be putting out. So smart meters pull out a pulse of EMF every 10 seconds to read your would you need to do that every 10 seconds? Of course not. Did I use an incredible amount more electricity in the last 10 seconds than I did 10 seconds ago? Of course not. But that didn't change how they did it. When smart meters appeared, I began to see patients who had been high-functioning executives, top of their field, who all of a sudden couldn't think their way out of a paper bag. They went brain dead. They couldn't think. They were anxious. Some of them had neurological conditions like dyskinesias and pseudoseizures. But it was a profound brain fog or fatigue that came on, and they didn't know where it was coming from. And after a while, they realized, oh, that started just a few days after my smart meter was installed. And so some of those patients were so sensitive that they had to leave the city that they were in. Back then, I was practicing in Northern California. They were in Santa Rosa, Oakland, San Francisco. They had to come up to where I lived, which was in the woods. And they had to find a home that was a quarter of a mile away from any other home that used any type of EMFs in order to function. They couldn't have any electrical use in their house. They had to live in cabins. Now, this wasn't psychological. These are people who are high-functioning people who shut down because of the installation of these smart meters. And the first one, to me, was astonishing. And the second one was, whoa. And the third was, oh, my goodness, this is really nasty stuff. We've got to be really careful with it. But again, it wasn't appreciated. The power companies were saying, oh, no, this is benign. There's no difficulties here. And so these poor people were ridiculed, made fun of, but I was treating them. These are bright, talented people. They're not making anything up. They just can't function in a setup in which the EMFs are present.
And also, what I need to point out, because there's a lot of skeptics that talk about the nocebo effect, and for people listening, we're talking about what critics are saying towards electrosensitivity sometimes, and wrongfully so, is that, this is probably the fear of radiation is causing the symptoms, the nocebo effect, right? The opposite of placebo. But if you have the symptoms first, and then you realize it might be caused by EMFs. That's the opposite of nocebo. It makes no sense. And this has been identified by a few researchers. I can link to one study by Dieudonné back in, I think it's 10 years ago, who was mentioning the fact that in most situations, clinically speaking, this is what is seen. People come in, they're sick, they don't think it's the phone or smart meters. They haven't read anything on the internet that the EMF guy puts out, or that Dr. Neil Nathan puts out, or other of my colleagues. They don't care about any of that stuff, but it just feel bad. And then they realize it might be caused by EMFs. Is that also your impression of how it's happening for most people?
And I can take that one step further, which is I first ran across this phenomenon in the early 90s. And I was working at that time with Dr. Norm Shealy, who's a neurosurgeon who developed a holistic health clinic that was world famous. Norm began to recognize this phenomenon, and he called it electromagnetic dysthymia. That was his name for it. It's actually a good name. Hasn't stuck, but it's still a good name. And he wrote a paper on that in 1992. It's working in his clinic. Norm would do a technique called brain mapping, in which you are wearing a little Velcro band connected to a computer, and it measures your brain waves in 21 different parts of the brain. It's a well-known medical tool. And he would take people who described the sensitivity, and he would take a simple electric clock. Well, so they're getting their brain waves measured, and this electric clock slowly is being brought down towards the head. And before it even touches the head, their brain waves would change for those people who are sensitive. To explain that a little bit more, brain waves consist of alpha waves, which are waves of relaxation, beta waves, which are waves of focus, theta waves, which are waves of creativity in the brain, and delta waves, in which the lights are on but no one's home. And so as this electric clock, which simply moved down, their brain mapping, their brainwave procedure would go from focused, relaxed to delta waves. Nobody's home, meaning they just go brain dead. And so when you watch that, I mean, this is not a psychological process. This is, you're literally watching someone's brain waves change when exposed to EMF. So from my experience, that was a profound demonstration or proof that this is not a psychological process. These folks have this experience. And if you take someone who's not EMF sensitive, you can do the same thing and they don't have any change in their brain waves. So it partly depends on the wiring of the individual, and as we're going to get into here, the medical conditions they've been exposed to that would affect their limbic system and affect their vagal nerve system to make them this sensitive.
Well, I think this is a perfect segue. So what are, let's say, the risk factors that you see, clinically speaking, that might explain why someone is developing a sensitivity and then the next neighbor or even their spouse is not?
Inflammation. Inflammation of the particular individual is what determines that particular process. And so if we ask, well, what triggers inflammation? The most common ones are mold toxicity, Lyme disease, particularly the co-infection Bartonella, and more recently, COVID. I mean, all of these are known inflammatory processes in which all of the symptoms of these conditions are triggered by the inflammatory reaction triggered by a toxin, as in mold toxicity, an infection, as in the case of either COVID or Lyme disease. So something is inflaming this body, inflaming, if you will, the limbic system and the vagal system. And in that state of inflammation, now they are more sensitive. So the good news is, if we can identify the trigger or cause for what is inflaming this individual, we can cure it. So you don't have to stay EMF sensitive for the rest of your earthly life. If we can fix what's making you inflamed, we can actually get you well. And so that's the really good news for folks, which is the key is to realize that EMF sensitivity is the result of something happening to a person, and treating it would be the way we would treat any toxin, which is avoidance, meaning measuring the EMF that person is being exposed to and blocking it to whatever extent that's possible. Or, as with any other toxin, let's use mold toxicity as an example. If you have mold toxicity, part of the treatment is you have to get out of the moldy environment. You can't get well, even with the right treatment, if you stay in a moldy environment. Body can't do that. EMF would be the same thing. You can't get well if you continue to have the same exposure that you have, even if you reduce the inflammatory process. But I want to add to that. As I'm explaining this, I'm missing a point here, which is if you get the patient to a non-inflammatory state, their sensitivity to EMF will become much, much, much less. So Not just EMF sensitivity. A lot of people with EMF sensitivity, as you might imagine, are also sensitive to light or sound or chemicals or food. All of those sensitivities will go away when you treat what's causing it.
So it's a multi-pronged approach. And it's probably, is it safe to say that the treatment of EHS needs to be greatly individualized because the causes of inflammation are many. But for one person, it might be their diet is still the standard American diet, the SAD diet with junk food. But maybe for the next person, they have a very good diet, but still they are still inflamed because of food allergens, for example.
Yes. So everything in medicine has to be individualized. We are all biochemically and genetically unique. So you could have a family of 4 in a household. One person will be affected by EMF and the others might not. We see the same thing with mold toxicity, by the way. Again, there's a genetic and biochemical predisposition to being affected by mold toxin, by any toxin, so that we'll have one person in that household being affected by mold and the others won't. And so the tendency is to go, well, it's got to be psychological. We're all living in the same environment. How come you're sick and I'm not? So it's got to be on you. And the answer is, yes, it's on them, but it isn't their fault. It isn't psychological. This is how their body is reacting to that stimulus.
So it's a kind of false logic we fall into. If we're 10 people in the room and one gets sick, it must be that one person that is getting sick for no reason because, look, we're 9 other people or 20 other people that don't feel anything, right? So it's this comparison between what is normal, quote unquote, and what is perceived as an exaggeration. Like, can you be that sensitive, right? It's just a little bit of mold. I see that. I hear that, unfortunately. So how do you personally, have you spoken to families like that maybe have a hard time accepting the degree of sensitivity and maybe the degree of intervention that needs to be done inside a home when it comes to mold or EMFs?
Very difficult question, because most human beings, in my experience, having practiced medicine for over 50 years, view the world through their own lens. Which is, this is my experience of the world. So in my experience of the world, this is how things are. So if you tell someone like that, well, your spouse is really sick and you really need to have to do some things to your home to make it safer for them, they'll go, but that's expensive and I don't know that I need to put out that money. I think it's their problem. It's not mine. I'm fine. So it's very difficult to persuade. I mean, it has to come out of love. And I know that many people love their spouse and are baffled by what is happening to you. This is really weird. But I want to assure your listeners that this is now becoming an epidemic. There was a study in England a few years ago in which they discovered that 1% of the English population was disabled from EMF and chemical sensitivities. 1% disabled. And that means to lesser degrees, 30 to 40% of them had some chemical and EMF sensitivity to some degree, which was affecting them symptomatically. We're talking millions of people. We're not talking one. To put it in perspective, and I hate to put it this way because it sounds terrible, we live in a very toxic world. We have done a very, very bad job of taking care of the planet that we've inherited. There are now over 350,000 new chemicals that have been introduced into our world in the last 50 years. You know how many of them have been actually studied in terms of safety? 500. So there's a toxic soup of stuff that has descended upon us as a planet, never studied. Our livers, which are the organs that have to work on this, are all working overtime. So in terms of this biochemical uniqueness we talk about, depending on the particular load of chemicals that you've been exposed to or you're ongoing exposed to, how well your liver is capable of dealing with it, that's another factor in determining how well am I able to deal with this toxicity. And another component of that toxicity, as you well know, is the EMF exposure in the world that we live in, which 50 years ago was pretty much close to zip. And now we have a profound EMF exposure with cell towers everywhere. You can live in a rural community and still have phenomenal access to the internet, warp speed, and you can be living hundreds of miles from the nearest city. I mean, that's what we've done to this planet. So we live in it. We're taking essentially a toxic soup that we live in. So I want to warn everyone, the people who are getting sick and showing up with EHS and these various toxicities, they're the canaries in the coal mine. They're just the tip of the iceberg. All of us are being exposed to this. This is not their problem. This is our problem, because ourselves, our children, our grandchildren are all having this increasingly toxic burden to deal with. We really have to own it so that we can really deal with it in a more effective way.
So how do we deal with it? When it comes to someone electrosensitive listening to this, I'm sure this is nothing you can explain in 5 minutes. This is a whole, but what is the main strategy that you would recommend someone look into with their hopefully open-minded, environmentally minded and trained physician? Where should they start retraining that limbic system, retraining that vagal nerve you talked about? There's detox in the mix. How can people start thinking about how to get better?
So I'll break this into two categories. One, we need to reboot, literally, the limbic and vagal system. Here's the good news. We can. There are many methods that are currently in use to quiet the limbic system when it's inflamed and when it's hyperreactive. There is the Annie-Hopper dynamic neural retraining program. There's the Gupta Amygdala retraining program. The word amygdala is another word for limbic, by the way. And there's many other programs that have been developed. These are easily available online. They're very easy to do, and they work. I've had over 1,000 patients each do Annie Hopper's program, do Gupta's program, and they're very effective. But I want to emphasize that in the sensitive individual, if the limbic and vagal systems are both hypervigilant, and they are, if you only treat the limbic system and you don't treat the vagal system, you're going to stay hypervigilant, and vice versa. So it's important to treat both the limbic and the vagal systems concurrently. Now, for the vagal systems, there are multiple ways to treat that. There are some exercises you can do. There's osteopathic cranial work is very effective. Frequency-specific microcurrent is a medical device that is very effective. There's another medical device called BrainTap, which can also do the rebooting. And there's beginning to be a huge outpouring of medical devices called vagal nerve stimulators, which specifically directly stimulate the vagal nerve a little bit just to get it back in balance. There are some you can wear on your wrist. There are some you can rub over your neck. So there's a whole bunch of medical approaches to quiet down the vagus nerve, to quiet down the limbic system, to allow these patients' sensitivities to markedly decrease. That goes along with, and I want to emphasize it, avoidance, meaning for the patient who has EMF sensitivity, it's really important that they get an electrosmog meter or a Stetzer meter to measure all of the different types of EMFs that they're going to be exposed to or are exposed to, so that they can pinpoint, I'm getting this exposure here in this way, and I need to block that. In your wonderful book, you've laid all of that out, which devices you can buy and which ones you can get hold of that you can block all of those exposures. So that information is really out there for people. So minimizing EMF exposure is important. Sometimes that's really hard. If you live in an apartment building with smart meters, you're getting exposed to other people's EMF. So that's really tricky. You may have to move or find a safer place to be while you're healing, or you're going to have some difficulties with that. So that's working on the specific physiological components of sensitivity. The other part of that equation is anyone with EMF sensitivity should be checked for mold toxicity and should be checked for Lyme disease and Bartonella, which are by far the two most common causes of triggering EMF sensitivity and other sensitivities as well. So if you want to check for mold toxicity, there are a number of laboratories where you can send them a specimen of urine. It's very simple. You send them a specimen of urine, and they will measure mold toxins called mycotoxins in the urine. It's very simple. If you have a high level of mycotoxins in your urine, you have mold toxicity. There's no getting around it. It's not maybe. It's there. It's actually coming out in your urine. So it's not a theory or an idea. It's objective. You can actually measure it. And our tests for Lyme disease have improved greatly, so that you can get some blood tests for Lyme disease, which fairly accurately can tell us that you have Lyme disease or the co-infection of Bartonella, and that you can treat that. So these are measurable. These are medically determinable. And here's the good news. They're treatable. So once you have that, we know how to treat it.
This is great news. And I think a second aspect to the message I want to send people today is, do you have strategies for people who are on their healing journey? Maybe they're getting a little bit better, but sometimes they have episodes of exposure, whether it's they don't realize that someone has a phone nearby. I get these emails from a lot of people that got exposed. Maybe they went to the city for 2 days and now they feel brain fog, but sometimes they tell me it lasts for days, if not 2 weeks. How can they have symptomatic relief short term to get back to a better place?
Boy, that's harder to come by.
Yeah.
Once triggered, it's triggered. The key is to not get triggered in the first place.
Okay.
Now, maybe you're aware of this, probably you are. There's a new medical device that I was told about that comes from Spain by the company called Pranan. And they make this device, which is a portable device that will block EMFs in a 3 or 4 foot radius around you. So that if you are out in public and you don't know what you're exposed to, it can protect you to a certain extent. The fellow who taught me about this is a medical doctor named Roger Billica, who was for 10 years the medical director of NASA. So he's very up on medical devices and how they affect people. Roger came across this device, and many of the devices that are sold, like amulets and pendants, I don't think work very well at all. So I've never been high on these devices. But Roger tested this particular device, and having used it now with quite a few patients, I'm really high on it as something that actually works. So if patients are interested in it, you can go to Dr. Billica's clinic, which is called Try Life Health, the TRILIFEHEALTH.com, trylifehealth.com, and look for a device called Phi Waves Graphene, which I'll spell. It's PHIWAVES GRAPHENE. And I've had some particularly good results with that device. And I want to tell listeners here that I have no financial connection to any laboratory device that I've mentioned in this discussion. I have none. So this is as clean as I can make it on my part.
Thank you. Thanks for the disclosure. And I do not have any affiliation with any of these personal protection devices. And I did emit a lot of concern and talk to scientists, medical doctors. Some medical doctors have been experimenting with certain pendants, crystals, pyramids. There's a lot of different approaches, but I want to get your honest opinion on this. And I think you already mentioned it, but maybe you need to restate it again. Do you consider that if someone holds a certain device and it makes them feel better, gives them maybe temporary symptom relief, would you also stress the importance of avoidance of EMFs at the same time?
No, the avoidance is more important. If anything that makes you feel better, great, use it. But it's a partial protection. It is not really preventing the complete exposure to EMFs, which will trigger a domino effect and might make you sick for weeks, as you're pointing out. So that's a stopgap. It's not the answer. And as I hope people are getting my message, part of the answer is fixing the systems that are making you sensitive in the first place by working on those systems and the things that are triggering it.
Great point. That's exactly my opinion. And I always tell people, if you find something that gives you symptom relief, you get exposure, you get brain fog, and you find something that you wear on your person, you don't get that brain fog, that's great. However, it does not make you impervious to exposures at all. And to the contrary, I find that some of these people maybe risk exposing themselves more in certain scenarios because now they feel good. It's a natural thing to say, oh, well, maybe I can go now 4 days in the city and be totally fine. So use them with great care, I'd say, and strategy, right? And for people that are extremely electrosensitive, that is. But as far as earthing, walking barefoot in nature, I heard some reports from physicians or electrosensitives that it might give them at least temporary relief when they get exposure. Have you found that as well?
I have. I am a big fan of earthing. Again, it's not a cure. Earthing allows the negative ions, negative electrons from the environment to come up into your body. That's great for quieting what we call reactive oxygen species, which is an inflammatory process inside the body. So it's very helpful for that. I have earthing sheets that I sleep with. It's been very helpful to me and my wife and our health. But it's not a cure. It's a partial treatment or quieting of inflammation generically. It's not the cure. So am I a fan of it? Yes. Is that the answer? Not completely. No.
Yeah, a lot of people are looking for the same paradigm that the medical system has been selling one pill for one ill, right? The pill for EHS. Oh boy, how many people would like to buy this one right off of the summit, right? Purchase now underneath this interview, and you take it. It's $100 per month, and now you're cured. Doesn't work because it's multi-systemic. It's complicated, right?
Yeah, I hope I'm making it as complicated as it probably is. There are physiological effects. We didn't mention this, but I'm sure your listeners are aware of Dr. Martin Paul's work on showing the biochemistry of EHS. Dr. Paul, who I've known personally for a dozen years, has worked out the what are called the voltage-gated channels in the body are specifically more sensitive in EHS-sensitive patients. This is a very specific biochemical process that it's not psychological. We're beginning to really get on top of it. I'd love it if there was a pill people could take one that would fix all these things I'm talking about. But fixing mold toxicity takes a year or more. Fixing Lyme disease takes a year or more. Not a quick fix. On the other hand, the effort in doing so is phenomenally rewarded because people can regain their health. They can wander around in this world safely, in a healthy way. And so that's the approach that I recommend.
That's tremendous. And this is, I find that in certain parts of EMF activism, let's say the idea has been passed around that EHS is bound to get worse. It's not curable. Don't use that word. It is a condition that they'll stay with. And sometimes I find out maybe people are associated with the ailment. I am EHS, and that's okay. And acceptance, I think, is key also. Accepting yourself, because if not, you're going to be in distress until this is fixed, right? It's not like the person is personally broken. The person is complete and is a complete human being. However, the message also, they can both coexist. I think that this can be treated in that way. You can improve your quality of life on this earth because this earth is toxic. And it's inevitable if you want to experience parts of this world, such as going in a city to visit a friend, you're going to get exposed to a lot of things that you shouldn't.
So those people are correct that if you don't treat it and you don't do anything, and if you want to become a victim and live with it, you will get worse. Because if explaining this correctly, if you're not treating the limbic and the vagal system, and if you're not treating what's triggering that, you're going to get worse. It'd be like any medical condition. It wouldn't matter what it was. If you don't treat the cause, and if you don't treat the systems of the body that sustain that system, yeah, you're going to get worse. But I want to take a counterpoint to that, which is, in my experience, it is treatable. And if you want to stay sick, fine. That's your right as a human being to do whatever it is you want to do. But gosh, if this information is new to you, that we can treat it, then please look into it and investigate it and see if you can find people that will help you to explore this in a way that will get you well, because you can.
Thank you so much for this message. And I think that this presentation really, at least for me, it really created a great summary, a great almost framework to work from. If I were extremely electrosensitive, thinking about the vagus nerve, the limbic system, maybe detoxification in there. You talked about Lyme disease. There are many aspects, but to explore with your physician, with your health practitioner. And as far as your efforts, Dr. Nathan, I know that you are also training physicians or health practitioners in doing this, and also you do consultancy work. Can you talk a little bit about how people can reach out to you if they need help, both as someone that is EHS or even as a health practitioner?
Sure. So I do have a mentorship program for healthcare practitioners. We have almost 200 people in the mentorship program. I do it with a fabulous naturopathic physician named Jill Crista. And Jill and I teach healthcare practitioners all of these things about the basic inflammatory conditions created by environmental toxins, mold, Lyme, co-infections, other infections that people have, EMFs, heavy metal toxicity. We didn't talk about lots of other things in this as well. And so we have this training program that we do where we meet for 3 hours every other month. We go over cases that our practitioners bring. We bring in experts and we give lectures to support that. So if there are folks out there interested, go to my website, which is simply neilnathanmd.com, and you can learn more about the mentorship program, and I would certainly welcome as many people as want to join it as they can. I am available for consultations, which I do with treating physicians. I'm not treating anyone currently. I retired after 50 years, 2 years ago, but I'm still consulting a great deal, in which I will lead the consultation with a physician and their patient. We generally do that over Zoom, and I'll go over the case in detail and give the physician and patient suggestions about what they're missing, what they should do, in what order, and I'm very happy to do that. Excuse me. I would mention to your listeners that I've written a number of books on this that you may want to go over in more detail. The one on mold and Lyme is simply called Toxic. That will give you a nice overview of these conditions and how to treat them. And I've just finished writing a brand new book called The Sensitive Patient's Healing Guide. Okay, The Sensitive Patient's Healing Guide. It should be out in ebook form in a month and a half, and by Christmas it should be out in its final form. We're still getting the graphics set up. The book is finished, edited, and it has 20 different authors, including myself, writing chapters on all of this, meaning Dr. Paul wrote a chapter. Magda Havas and Rena Bray wrote another chapter on EMF sensitivity. So I've got a couple of chapters on that in there. Annie Hopper wrote a chapter. Gupta wrote a chapter. Steven Porges, who put the work of the vagus nerve on the map. On and on and on and on. So literally, it's a who's who of people in this field have written to help people understand we have a science behind becoming sensitivity, and we know how to treat it. So I think this is brand new information. I'm not aware that there's been a book like this out yet. So I'm very excited because I'm hoping that it will give patients and their families and healthcare providers a really good overview of, yes, there is hope for you. You don't have to stay sick. We know enough about it that we know how to fix this now. So I'm excited about that.
I'm very excited that you are releasing that. I can tell you I've been studying the topic, EMF dangers, sure, but electrosensitivity in particular for 7 years. I never heard someone that can so eloquently explain the action steps and the different systems that are affected by these sensitivities and the framework to get better. So since you're putting that in a book with some of the world's foremost experts on so many important subtopics, I think this is very important work. I'll be more than happy to include that in the show notes along with this interview for everyone to see. And please support Dr. Nathan's work by getting the book, especially if you are sensitive. So you can share that with your physician, with your family. And I think it's going to contribute to putting an end to this really incredible, very sad state of affairs where a lot of people are being medically bullied by people who don't know better, don't understand the condition, cannot treat it, are in disbelief, and are doing a lot of harm to these people in the meantime.
Right. I call it a travesty.
Yeah.
It's not honoring human beings' perceptions. And we should always honor human beings' perception. Again, having done this for a very long time, when someone tells me something, I believe them. It's almost nobody makes it up. I know there might be a few malingerers. There might be people who want attention for it. They are really few and far between. The vast majority of people who tell me their stories, it's true, it's genuine, and especially for people with families, if someone's telling you they're experiencing something, honor that. They are. But unfortunately, many of these people go to physicians who tell them, no, this is in your head, and you need to take an antidepressant or a benzodiazepine. And families hear that, and they go, well, the doctor said. And no, if your loved one tells you they're feeling awful, believe them.
This is an incredibly important message. Thanks so much for your time, Dr. Nathan, and I hope that we can continue this conversation, maybe talk about your book next time, and continue spreading the message.
Thank you very much for having me, Nick. Appreciate it.